spent in a miserable way.
U.S. News: Trump effect drove rise in women getting long-acting contraception. Daily Mail Online. More women began using long-acting reversible contraceptives after the 2016 election, a new study finds. Researchers say there was a 22% rise in women who had intrauterine devices, IUDs, and implants inserted in the 30 days after President was elected. During his campaign, and while in office, the President vowed to roll back the birth control mandate nationwide and to cut federal funding for contraceptives and abortion. The team, from Brigham and Women's Hospital in Boston, Massachusetts, believes this led many women to fear they would have access to birth control and wanted to ensure they were protected against unwanted pregnancies. A new study has found a nearly 22% increase in the use of intrauterine devices and contraceptive implants in the 30 days after President Donald Trump's election. I find the magnitude to be impressive, lead author Lydia Pace, an associate physician at Brigham and Women's Hospital, told Daily Mail. It shows women's contraceptive choice or can be influenced by political events. For the study, published in the Journal of the American Medical Association Internal Medicine, the team looked at women between ages 18 and 45 covered under private health insurance. Researchers studied more than 3.4 million women in 2015 and more than 3.2 million women in 2016 and their use of LARCs in the 30 days before and after the 2016 election. Then, they compared the results with the same time period in 2015. They found that, in 2015, about 12.9 per 100,000 women had an LARC inserted in the 30 days before November the 8th, and 13.7 per 100,000 had one inserted in the following 30 days. But, in 2016, the rate of insertion in the 30 days prior to November the 8th was 13.4 per 100,000 women compared to 16.4 per 100,000 in the subsequent 30 days. This means there was a nearly 22% increase in the use of IUDs and contraceptive implants. 1. Hormonal IUD. An IUD is a T-shaped metal bar that is implanted in a woman's uterus. The hormonal form releases a synthetic form of progesterone that makes it difficult for sperm to enter the vagina and fertilize an egg. 2. Non-hormonal IUD. This version of the IUD is made from a copper coil A. The material deters sperm from entering the vagina. Both forms are 99% effective. 3. Implanter. An implant is a small tube placed in a woman's arm. It releases the progesterone, a form of progesterone, that deters sperm. The implant is between 98% and 99% effective AA. I find the magnitude to be impressive, lead author Lydia Pace, an associate physician at Brigham and Women's Hospital, told Daily Mail. It shows women's contraceptive choice or can be influenced by political events. Additionally, the researchers say there were 2 more insertions per day following the 2016 election than in the 30 days before and the same period in 2015. LARCs are regarded as the most effective form of birth control with a 99% efficacy rate. This means that fewer than 1 in 100 women will get pregnant while using one compared to the 9 in 100 women who get pregnant while using the pill, according to a 2011 from the Washington University in St. Louis School of Medicine. However, according to a published last year by the Centers for Disease Control and Prevention, LARCs are the 3rd most common method of birth control AA. They are used by a little more than 10% of women on contraceptives compared to about 19% who have undergone female sterilization or around 13% using the pill AA. In 2012, under the Patient Protection and Affordable Care Act ACA, out-of-pocket costs for female contraceptives was eliminated for women covered by private health insurance. This means that women went from paying nearly $40 out of pocket to $0, which led to an increase of LARCs. In addition, health insurance plans provided by an employer were now required to cover birth control under the ACA. But the researchers say the Trump administration has been working to weaken birth control mandates. During his campaign, the president vowed to repeal the ACA and to cut federal funding to Planned Parenthood AAA. In November 2018, the Department of Health and Human Services issued a rule that says employers may be exempt from the contraceptive coverage mandate if they object due to religious beliefs. Non-profit organizations and private employers could also be exempt on moral grounds. Women believe their main threat to access is the final rules released by Trump's administration expanding exemptions, said Dr. Pace. They're under injunction right now, but this could be impacting women's behaviors. The comments below have not been moderated. By posting your comment you agree to our. Do you want to automatically post your Mail Online comments to your Facebook timeline? Your comment will be posted to Mail Online as usual. Do you want to automatically post your Mail Online comments to your Facebook timeline? Your comment will be posted to Mail Online as usual. We will automatically post your comments and a link to the news story to your Facebook timeline at the same time it is posted on Mail Online. To do this you can choose on each post whether you would like it to be posted to Facebook. Your details published by Associated Newspapers Limited. Part of the Daily Mail, the Mail on Sunday Metro Media Group.
Raindrop, drop top, top smoking, no cooking the hot. Fucking on your bitch, yeah, that.